Hi everyone, my name is Mariah Flores, and this is my persuasive speech on universal healthcare and why the United States should implement it. So, what is universal healthcare? So, universal healthcare is a system implemented in which all people, regardless of differences, can access medical treatment and assistance without facing financial hardship. A lot of countries in the world have actually adopted universal healthcare as a way to not only help their citizens but also to boost their own economy. What are the core values of universal healthcare? So, the core values of universal healthcare are equality, accessibility, and financial security. The equality aspect ensures that all receive equal care and access to it. The accessibility aspect ensures that all, regardless of what is going on in their life, whether they can or cannot financially afford it, receive the care that is needed, especially life saving medical treatment. And the financial security assurance is that it's an assurance that basically you will be able to live your life after whatever disease you have has run its course in your body. A lot of people struggle with the financial security aspect after becoming sick because they're unable to pay for other basic life expenses because being sick really takes up a lot of money, especially medical treatments for things such as cancer, autoimmune diseases, and things like that. So, why the US? So, the United States is one of the leading nations in the world where each year thousands of people go bankrupt because they don't have the money to afford to be able to access life extending medical care as well as life changing medical care. And some things are very simple. Even things such as like a cleft lip surgery can be very, very expensive. Even though it's not a vital procedure, it is a vital procedure in the sense that it allows people to be able to function regularly. Things like that can be very expensive. Anything from a surgery like that to a kidney transplant can be extremely expensive, and it can also put people in debt. So while the United States has the highest medical budget in most of the first world countries in the world, many people do not receive the same access as others do. And as you can see on the side, I have a chart that is stating basically all of the countries listed in this chart have universal healthcare except for the United States. And the amount of people that go bankrupt each year because of medical bills and not being able to afford basic life after that is 643,000 people in the United States, while in places like the UK, France, Japan, Germany, Canada, the Netherlands, and Switzerland, which are all countries that have universal healthcare, the amount of people that go bankrupt each year is zero for medical bills and medical debt. This is another chart that is explaining how Americans pay the most for surgery out of any other First Nations in the world. And the First Nations that were used for this chart were the UK as well as Switzerland. And so, as you can see, the average American pays $29,067 for a hip replacement, while in other countries like the UK and again Switzerland, the cost is around 17,000. So Americans are paying a lot more than a lot of other countries with universal healthcare are paying. And this is why people historically in the United States have gone into debt because of um, medical things like this. So, medical debt compared. According to the American Public Health Association, the United States spends four times more per capita on administrative costs for healthcare than comparable countries with universal healthcare. These are countries like Canada, the UK, Switzerland, things like that. And according to the same source, the United States spends more money on healthcare than any other country that implements universal healthcare, yet it hardly achieves better results. In the United States, there are a lot of diseases that go untreated because people cannot afford to treat them. So, in that sense, people can go for a treatment or two, but they can't do the entire round that they need. So, this leads to them not being able to fulfill their treatment cycle, which also leads to things not being treated, which leads to us, having an issue with higher mortality rates with certain diseases because people can't afford to to get the treatment that they need for them. So, some of the real stories that have affected people in the US with healthcare is according to the West Health, a study that was conducted by West Health, 34 million adults in the United States know someone who died after not getting the treatment that they needed. 58 million adults reported the inability to be able to pay for drugs that are needed just in this past year. These are things like insulin, these are things like cancer medication, these are things like asthma inhalers. I've actually heard stories of people dying because they can't afford to cover the cost of an asthma inhaler. And asthma is like one of the simplest things to kind of keep under control when you're actually able to access the medication that you need for it. So, how a universal system could save money and lives. The American Public Health Association conducted a research study in which concluded that if the United States adopted a universal healthcare plan, the single payer system could save around $400 billion a year while also building a better healthcare system and economy because less people would be going into debt and more people would be getting treated. And with a universal healthcare system implemented, more people will have access to life saving treatments that they will need, which will lead to a better economy because people won't be going into debt so much and people will actually be able to access the medication that they need and then they'll be able to contribute better. And so, in conclusion, the universal healthcare is a right that all should be afforded because it's a basic human right. You shouldn't lose your job or your house or anything of your belongings and possessions because you got sick. So, by implementing universal healthcare in the United States, we can build a healthier, stronger, and more resilient society while saving lives and giving people the opportunity to access the right to treatments. And then these are my sources. Thank you for listening to my speech, and I hope that you were able to learn something.